Debates. I believe we're online and live now, so welcome to everyone at home and welcome to everyone here at Blocks. Historically, major crises have changed the way we build cities, and COVID-19 is no exception to that rule. Today's debate is titled The Impact of COVID on Health and Housing Inequalities. And this debate is a part of the BLOXHUB Debates series made possible by the partners you see on this screen in a collaboration. Myself, I am Katrine Hertz Mortensen. I'm from the Danish Design Center. And together with our sister organization in Norway called DOGA, we've planned today's debate. During the pandemic, social inequality has become even clearer than it was before, and this is reflected in a wide range of factors such as unemployment, loneliness, housing conditions, and the increased spread of infection in societal vulnerable areas. For instance, in Denmark, citizens with a non-Western background represent approximately 9% of the Danish population, but 18% of the COVID-19 infected citizens. And studies in the UK show a connection also between low income, poverty, poor housing conditions, and minority background and cases of COVID-19. So the connection shows inequality in health and housing, but not only does it highlight the inequalities, it also highlights increased loneliness among citizens in all age groups, predominantly among young people, which is probably no surprise to most, since they have the most active social life, but also among citizens between 45 and 79 years old, where 9 to 10% state that they have felt lonely during the COVID-19 crisis. So, social inequalities and mental health issues as side effects to the pandemic. Now, how can we ensure that future cities do not contribute to an even greater social inequality? To give us an insight on these perspectives, we have our 5 panelists today. Some are here in the room and some are with us virtually. So we start with the screen at the end. Senior Consultant at Office of Urban Strategy and Growth in the city of Odense, Jessen. Welcome and good afternoon. Head of Development at the Housing Association 3B, Mikkel, right here in the panel. The Head of Architecture at Norwegian Association for Architects, Camilla Moneta. Welcome to you and good afternoon. Resident at Kamelia Hus, a co-housing community for senior citizens, Aksel Goth, welcome to you here with us in Blocks, and a founding partner and architect PhD at Helen Hard, Siv Stangeland, welcome to you as well.
Thank you.
So Camilla, Siv, and Aksel, we're going to get back to you guys a little later and start up this first part with Mikkel and Bo. So let's start out with you, Bo Jessen. You are in charge of the urban strategy and growth in the city of Odense, the 3rd largest city in Denmark, if anyone is not aware of that. So first and foremost, I'm curious to know, how has COVID crisis taught us that we should plan our cities differently from now on?
Well, first of all, thank you for allowing me to participate. I think that the crisis have revealed to people what they could already sense with their bodies. I think that having proper housing, jobs, human contacts, and access to green spaces is a basic necessity. And people have realized this, not only with their bodies, but with their minds now. I think at the same time, it's become clear for us that these qualities are not evenly distributed between different parts of the city, different parts of the population. And this is, of course, a problem in times of a pandemic, but it's just a bigger problem when there is no pandemic. And I think people have been reminded that taking care of the elderly, the sick, and the vulnerable is the responsibility of all of us. This is not something new for urban planners, but it's a reminder of the importance of planning for these qualities, not as an afterthought, but as part of all projects. So my basic answer would be that the good city is good regardless of the pandemic, but the pandemic have revealed to more people what the good city is.
saying, amongst others, a quote here, it would be natural to respond to a crisis by rejecting what we know or moving on as if nothing had happened. But it's right now that we have the space to frame new visions and demand that what we do in the future contributes to improving our cities. So what should we demand of future cities based on the experiences we have now from COVID-19?
Well, I think when we wrote this this article to the newspaper Politiken Byrum, our reaction was against a polarized debate, either celebrating identity or rejecting it altogether. And our point was that we have to find a third path where we combine what the dense city has to offer, but with the qualities of the smaller city, the intimacy, the social coherence, and the green qualities that doesn't come by itself in cities. So I don't think that people stuck in small apartments during this pandemic who have realized that good housing in nature is essential for their well-being wants to skip social interactions or the job opportunities that big cities provide. So this is basically my point, that we have to take the best from the dense city and combine it with the qualities of the smaller city. And of course, this is difficult for several reasons. One is that market forces doesn't tend to prioritize green qualities and social coherence by itself. Another, of course, is that creating an attractive city means that it will become less affordable at the same time.
It also doesn't seem to be at the heart of the planning exercises that people make throughout the world when they plan the bigger cities. So in a city like Odense, how do you deal with this? How will it affect the future planning of your city?
Well, I think, first of all, what you have to understand about Odense is that we've been going through a big transformation for the past 10 years. The financial crisis took away a lot of industrial jobs. It ended the city's identity as an industrial city. And so we began a big transformation from what we might translate into a small town to a great city. But along the way, we gradually came to be aware that we have to base this transformation on the qualities that's already present in Odense. The strong communities, the green qualities, to avoid becoming a bad copy of bigger cities with all the same problems, the lack of green space, the overcrowding, the social segregation. It's not to say that we have found the golden solution to everything, but now our basic vision is to create a balanced city. I think we do this, or this is done through, first of all, political leadership. Having a well-defined vision that is inspiring. Second, to follow up on that strategy, both by investing in these qualities and by demanding from investors that they participate in creating these qualities as well. And I could mention one example is the big social housing area. The biggest social housing area in Denmark, Vollsmose, which is located in Odense. I don't want to tire you with this, but the government decided that we needed to tear down a lot of social housing in Vollsmose. And what we decided to do in Odense was to replace these houses, social housing, one-to-one with social housing in more affluent parts of the city, to try to connect Vollsmose better to the city center and to the rest of the city. So it's basically about having the political leadership, the vision, and then being able and having the guts to follow it through.
And you've already almost answered my next question, but let me just end up by asking what I initially started out with, actually. So your best bet on how we can ensure that the city of tomorrow will not contribute to increased inequality and vulnerability when the next crisis hit us?
I think the point is in your question, when the next crisis hits, because the social equality and healthy green city is not created during a crisis. It's created when the economic cycles are positive. So instead of translating positive economic cycles into more consumptions, this is when we need to invest in better welfare. This is when we need to invest in social housing. This is when we need to connect the disadvantaged areas to the city jobs through improved infrastructure. And this is also, of course, about attracting more jobs, functions, investing in urban spaces and green qualities in the more disadvantaged areas of the cities.
Thank you so much. For now, Bo Jessen, we'll get back to you, but just now I'll pass the word on to you, Mikkel. You're the former social mayor of the city of Copenhagen, and now you're the head of development at 3B, or 3B, a part of KAB, who is almen boligbyggeri for people who know the Danish term. And you have yourself lived in social housing most of your life, or for many years. In your opinion, how can the public housing sector contribute to remedy this a little bleak picture that we were discussing before in the future?
Well, first of all, I'm also grateful to be here and participate in this quite important debate, because what we have seen is that the pandemic has sharpened the tendencies there was in the beginning. It's sharpened tendencies for inequality, sharpened tendencies for segregation that exists in the capital area and all larger city areas in Denmark, and where the housing market is the motor of inequality and segregation. And as you said before, we have seen also in our areas that we have feared and have tendencies to larger infection rates, because people are poorer, people live more together, and so on and so forth, and speaks better Danish as well. What can we do? We did a lot before the pandemic, and also that's some of the things we have to consider. How can we turn up the volume on local social work, and trying to get what we do in 3B, for instance, have social economic activities and companies out in the areas, try to make which we do as part of KAB also, the larger housing administration company that we are part of now, try to make new ways of making social sustainability in larger housing areas, to work with the municipality, work with NGOs, try to make extra efforts in the area towards children's going to school, towards mental health, physical health, loneliness, and participation as well. So we have to, and are considering, how can we turn up the volume when we get on the other side of the pandemic for all these activities that we did before as well. But we, as we've said, we are seeing that the pandemic has sharpened the tendencies. The inequality is rising, and we are quite afraid, because we have areas as well as Vollsmose in Odense on the so-called ghetto list, which is five criteria, and one of them we can't do anything about. That's the ethnical composition of the area. But the others we can do something about, and that's how many are at work, how is the income, what's the level of education among the older people, and how many sentences do people who live there have. And what we are afraid of, we have areas who are on or around the list, and if you are on the list in a couple of years, then you get to demolish 60% of the public housing units in the area. You have to sell them, or you have to demolish them. As you said in Odense, you're demolishing 1,000, hopefully, and we're glad about that, building them one-to-one other places. We don't want to demolish apartments. People live there. They're good apartments. They're cheap apartments in a housing area. But we are afraid that the crisis who are hitting service sectors, people with low education harder than people like us in the panel. And therefore it hits residents in our neighborhoods harder. And that can contribute than areas who were perhaps moving away from the list are getting on it. And that's something we are very concerned about at the moment, and working very hard to try to stop areas from becoming on the list and getting to demolish these areas. And in a boiling housing market, as the capital is, to remove thousands of cheap apartments would contribute to larger inequality and less accessible housing market. So we are fighting on a lot of areas, but we have to turn up the volume, to go back to your original questions, on the social activities that we did before, to try to lessen the inequality, lessen the segregation, and getting a more mixed population. And one I think we're coming to, how do you build in the future, but another one is try to lift the people who live there, instead of only. That's a part of it, is to get new people to move in. Another part is to lift the people who live there.
Yes, and a part of that, you already mentioned a little bit, participation. I'm thinking you probably already used to work a lot with civil actors in these areas as well. So that kind of motivation and participation can be a little hard maybe to foster when we have the COVID-19 crisis. So how can public housing sector, normally a little depending on people being able to be social and to participate, how can the public housing sector, with your eyes, contribute to remedy? How can it have? What kind of impact will it have? That was what I was going to ask on the coming planning of social housing in Copenhagen.
Well, when you asked about participation first in the sentence, and that has something that's been hit. We are a democratic sector, meaning that the residents, as yourself, I live in public housing in the Southern Harbour area. I've been there for over 12 years now. And we have a local housing democracy, local housing associations that the tenants, residents, that we control. And we are dependent on meeting in real life. So of course we're trying to develop, can you make it more digital? But it's a problem to do it, also because our rules forbids us to do things digital. So that's one thing. The other thing we have been experimenting with as a housing association during the pandemic in some of our areas, especially the areas where we have local staff, local social workers hired by the housing association. We have been experimenting, how can we reach people? How can we make activities with people who can't leave their home, with people who can't meet anywhere but outside and in very small numbers? Yeah. And that all from trying to call people, getting word by mouth to mouth, experimenting with activities where you are far away, and so on and so forth. I think perhaps we'll get back to that later, because that's a part of the social structure in housing in our areas. But we are making experiments. How can we participate better? And will it have an effect? Yes. As I think Bo also said, we have to again sharpen the tendencies. We have to plan for green areas that people actually use instead of the large grass areas that no one uses. We have to plan for make more plans for how close do we build? How large are the apartments? How many can live in small apartments? Not that we can decide it, but we have to think about it. Have to plan for how do you make local community actions in an area, because the physical way you build, the way you plan an area also can either make it harder or easier to make local community actions or initiatives in an area, and so on and so forth. And of course plan for mixed population also in public housing areas.
And while you're doing this, I've been told you're actually now working on a new strategy. How will the experiences from this crisis, how will that affect that strategy? Is there something new that's been brought to the table? Because some of the problems are old, but they've been sharpened, as you say.
Well, actually, the way we are going to work on the strategy is very influenced by the pandemic, because we should have, tomorrow we should have it have been on the agenda of our General Assembly. Because of the pandemic, the Assembly has been shortened and only the very necessary things are on the agenda. but it's still physical because. And so we are working the next half years. We are working with the strategy out in the local neighborhood associations, local residence associations. And we have to do it under a pandemic and find a way to get people to make activities, to make discussions about the strategy during a pandemic where we can't go down in a local room and meet everybody. We can't do that. What activities are we going to do? What meetings, what discussions are we going to have? That's one thing. And the other is that all the local community activities and initiatives that we saw during the spring, during the first lockdown, will of course has been a part of some of the values and some of the ideas and some of the behind the strategy and some of the things that we are trying to work on and build on when we're going to get the strategy to live now before it's getting to a vote and hopefully being passed, and instead of after.
And we just touched upon earlier the increased loneliness as well, spreading in the larger cities, and Boden mentioned this lack of feeling like you belong in some kind of society, mini society in the cities. That leads me to ask you if there's been taken different initiatives, but how can the social housing, or has it been valuable because people are generally, that's my prejudice anyway, speaking to each other a little bit more in the social housing areas than many other places maybe. How is it the social housing that we have in Copenhagen proved valuable, if it has, during the crisis?
Because we have the infrastructure. From a local residence associations, residents who live there, who can take initiatives, who know who is perhaps sitting lonely. Where do we go and knock? Where do we slip a little note with the number for the Red Cross who can come and help with shopping if people are either sick or afraid to go out? We have a local infrastructure in all the areas of the residents themselves who have organized themselves. And we have a lot of activities before that. It's pool clubs. It's elderly who make gymnastics. Things that typically go under the radar, but who exist in these areas, that the tenants, the residents have organized themselves. We have the infrastructure to try and cope with a pandemic where we are forced into our own homes. I'm not saying it's been successful everywhere, it hasn't. And people, of course, especially in the spring, were lost, also in our areas. And when people are poorer, when people are older, when people can feel more lonely, yes. And that has happened in our areas where we have an infrastructure that we try to use and used to get more local community reach out to people. When
it comes to helping each other in these different housing areas that you touch on, you've just mentioned the Red Cross or the, slipping the note under the door. Has there been any examples that you could share with us today and elaborate a little bit on? When initiatives that can, not cure, but better the experience of being in a global pandemic?
Well, on a local level, of course, because what happened, for instance, in an area called Høje Gladsaxe, in a large area, two local girls, as soon as the country was put in lockdown, organized other youth to go out and knock on doors with the elderly and offer to get groceries for them. People were very afraid to go out in those weeks. Some are now as well. That's one thing, that themselves organize to help each other. Other things have been that you have organized different kind of activities to try to bind people together. Another housing agency, the one that I live in, not 3B, I might say, people have organized silent discos, which is that you get something like these, wireless, and hear the music from a DJ down there, but only the people with these things. Other areas they have made high-rise buildings or bingo, where you from your windows one shouted out the numbers and then you shouted back. So trying to make activities that bind people together and get at least some entertainment, some sense of belonging in an area. But most of all, and that has been overall, people have helped each other. And if they not have done it themselves, then have tried everywhere to give access to and numbers to and contacts to NGOs that put up help to people who were lonely and afraid and couldn't go out.
Thank you so much, Mikkel. For now, I just want to remind everyone that you're able to ask questions online. Everybody, do we have any questions so far from our panelists? No? Great. So remember that you do have the ability to pose questions when you follow this debate. And I'd like to build a little bit upon some of the things that Mikkel just said about the sense of belonging, because we're moving into a different part of this debate where we've been discussing the city planning now and the social housing initiatives in the light of COVID-19. But the pandemic has also highlighted the importance of how we live and organize in general in our cities. And especially during the lockdown times where many of us experienced other needs and demands concerning our homes, while serving as a home office, a home school, or a home kindergarten, whatever was your game, it suddenly posed new demands for the way we live in our own house, in our own houses or apartments. And in general, we've been spending a lot more times at our homes than we used to do. So if we talk a little bit about the way we live and how that affects and how the crisis has affected the way we live and our social lives, I would like to welcome you, Camilla Moneta, from our screen here. You're head of architecture at Norwegian Association for Architects, and you have discussed a concern for the missing flexibility of our homes and how we design apartments today. I found this article in the Norwegian newspaper Aftenposten where you pointed out how the COVID crisis has made this even more visible. So just a quick quote before I pose your question. The corona crisis is an example of a sudden change, one that in the spring eliminated the physical gap between school, work and home. For many, the home office is here to stay for a long time to come. Families are affected by stress and reduced quality of life due to poor planning. Can you please elaborate a little bit on what your concern is with today's design of how we live?
Yes, well, hello, thank you for inviting me. I was looking back actually to my first flat when I wrote this article, and that was a flat that was designed in the 1920s. And it is a very good example of a flat that actually I don't live in anymore, but I lived there for 10 years. And it's a flat that was adaptable to all sorts of changes in my life and has been for nearly 100 years now. And this is a flexibility that I think has gone lost in a lot of the new flats that are developed. And my flat was 52 square meters, and it had 2 rooms that were 15 square meters big and a kitchen with the same size, 15 square meters. I could use it to rent out when I was a student. I rented out 1 room and we shared a bathroom and a kitchen. And when I had my own family, we could live there for some time with the baby, and it worked really well. Today, such flats, they would be called not 2 room and a kitchen, but they will be sold as 3 rooms and a corresponding apartment size in modern apartments. It would be sold with 2 very, very minimal bedrooms and a living room that is joined with the kitchen, where the kitchen cabinets are stacked along a wall at the bottom of the room, where there are no windows usually. So my point was that we have actually lost the kitchen in the smaller family flats. And we have also lost the flexibility in the planning. And I have actually looked at a doctoral thesis from 2006 where Bendik Manum actually is talking about how these changes have been in the flats. And basically the rooms are a lot less general today. Where before the rooms, like the bedroom and the sitting room, were more or less equal size, like 15 square meters, 18 to 20 square meters. Today there is a huge difference. The bedrooms are often down to 7 square meters. It can only be used to sleep in. So, and also we have the wet rooms. They are all now in one little bathrooms where we are supposed to clean and wash our clothes and dry our clothes. And before we had storage where we could, in the basement, have common laundries, and in the loft we could hang up clothes, and all this is now moved to the flats. Also, the storage rooms are reduced. often the balconies are used for extra storage. So there are many good things happening about technical standards of the new flats today, but when it comes to the planning, I think we have moved backwards, and not in a good way. I think something that we did before was much better. So basically, my concern was today, when we are spending so much time with our families in flats where we only have one room together and no rooms to close the door and be alone with a friend with a laptop or anything, we are putting a lot more stress to families. And that was what I was wanting to talk about. And now I can't hear you.
Oh, can you hear me now?
Oh, there you're back. Yeah, yes.
Okay, I think most of us can probably relate to what you're saying. It's very clear once you point it out in that way. So if you, as an architect, would try to, what could you suggest we do differently in order to plan this? Is because it sounds like a big turn when it comes to the planning of these houses, because it's looked like this for several years now with the smaller bedrooms and the big communal areas with kitchen and living room. What do we do?
Well, yeah, sorry.
Did you hear my question? Just asking, what would you suggest we do?
You can repeat, please.
What would you suggest we do differently in the future?
Well, I think what was working before was that usually the small flats had lighting from two sides, so that made it easier to plan them. And they were more general rooms, so it made it easier over time to change the rooms after which sort of use you wanted. Also, I think when we plan with a corridor, rather than using the common room, the kitchen / living room as a corridor, it also is easier if we could, basically go back to a bit more simple planning solution, lights from two sides and more general rooms. But this puts pressure on the developer because they often want to make flats with just lights from one facade because it's easier to develop a site in that way with more flats.
And how do you think, or can you predict what the corona crisis will have, what sort of impact will it have on our future planning and designing of our homes? Is this something that, are you all alone by pointing these problems out, or is this something that will take root in the way we plan the cities to come?
It had quite a few comments, this article, in the social media and in the newspaper. So I think a lot of people feel this stress when you only have one room as a family. So I think a lot of people think that they would like to have a bit different planning solutions. I don't think it's a matter of making bigger flats, because I think we should make plans that are very area efficient, but it's the way that we solve them that makes a big impact. And if it's going to change, that's difficult for me to say, but I think if architects and developers could work more closely together, maybe we could have more clever solutions.
And do you have any piece of advice for the homeowners or tenants that they can be aware of when they are perhaps in search for a new and more flexible home?
Yeah, I think if you look at the flat and think, what will happen here if I have a baby, if I get divorced, if I get sick, if there is a pandemic, would this flat work for me, or would it require me to move after a short while? And I think if the question is yes, it could work under several circumstances, maybe it's a good investment.
Thank you so much. We pass that on to everyone listening and watching. And we're going to stay a little bit on the topic of how we live, because during the lockdown, as we touched upon several times now, the loneliness between citizens have increased, especially among elderly and other vulnerable citizens. And even among the young. At the same time, we see new formats of housing inspiring new formats of co-living opportunities that become a little bit more popular now, or taking on a popularity in the Nordic region. But the question is, can social initiatives and new co-living possibilities be a weapon or a part of the solution in the fight against social inequality and loneliness when it comes to pandemics? And to discuss this, I'd like to introduce an architect, PhD, and founding partner of the architectural firm Helen and Hard. That's you, Siv Stangeland. You're a co-founder and part of the co-living project Windmill in Stavanger, Norway. Could you please tell us a little bit about what Windmill is?
Yes, thank you for participating here first. Back in 2011, Helen and Hard, together with a green investor, was creating a vision for a new model, a new co-living model. And we wanted to focus on different areas of gain by sharing more, environmentally, of course, socially, and architecturally and economically. And it was developed to work in a normal commercial housing market, and it should be available for all ages and life situations. And Windmøllebakken was the first pilot project that was finished 2 years ago now. And it consists of 40 apartments. They are slightly smaller than normal units, but fully equipped. And they're organized around 500 square meters of shared space, which have different usage and is owned with an equal share for each apartment. And there was a facilitated user participatory process running in parallel to the planning and to the building process, allowing people to influence both their home and the program for this shared place. I can tell a little bit about how it is arranged. You enter through a central courtyard into a double height, half climatized hallway with the plants and herbs, just beside a kitchen and a living room. And here are workshops, guest rooms, a lounge for co-working, a play corner for children. And then there is an amphitheater leading up to the galleries for the apartments. And you can also go further up to a library on the rooftop where there is a greenhouse, and you can also grow your vegetables. So there is a sequence of rooms that are designed to create visual connections between your apartment and the shared space. You can follow what's going on in the community. You can choose if you want to participate or not, which is very important. And you have this freedom to engage if you want to. Another important aspect was that it's built with timber, so it gives a very good indoor climate. Of course, it reduces the CO2 emissions in the building stage, but it also brings experiential qualities to the living spaces. Yes, so at the moment we are 7 children, 3-4 youngsters, 10 retired people, and 45 grown-ups between 20 and 65 years living here together. And it's organized as a cooperative, but it's self-organized in the way that no one are running this place. We are, in fact, 26 different groups that organize around maintaining and taking care of the different activities that we need to care about. And that's, of course, also important social arenas for the people living here. Yeah, I can talk a lot about the...
I would like to ask you a question about, because we hear a little bit about how you're organized, but how was the everyday life during the lockdown or this pandemic? How has that been different, seen through your eyes for a mini citizens of Windmøllebakken compared to other citizens of Norway?
Yes, actually, a lot of the people living here has a very good memory of that period, which is nearly not able, it's not good to say, because we know very well that other people didn't have that. But during the lockdown, in fact, the social life was flourishing here because more people were at home, and we were organizing concerts. We were singing together in the courtyard in the afternoon. We made a film together. We celebrated Easter with a great dinner using the whole house. So there was a lot of creativity and caring for each other in that period. And we could do this because, of course, we have a good organization. And I think there was a new group forming at that period to really care about how we could make our distancing rules and other safety measures work well. And of course, it works well because we are coordinated and organized, and we have this extra buffer zone between our apartment and the public domain. So there is an extra spatial potential that makes it possible for us to be social with a distance, even in those times. So that's, I think, the key to this experience that we all had.
So actually, in your point of view, there are positive social benefits in shared housing and co-living, especially during these crisis times?
Yeah, I think what a co-living provide is a community space, which we all often are lacking in normal housing projects today. And this gives other possibilities of organizing during such a period. Of course, it has to have rules, and it's not easy. We also have to take the restrictions serious, even more so because there are elderly people living here, and it's also a risk. But because we are organized, because we have a trust in the rules and we follow the rules that we are agreeing on, I think it is a potential of solving such hard times where we have to be more careful with how we socialize.
And in general, what do you think is these new revitalized forms of co-living offers in times of crisis? I mean, not only this, but also perhaps the next crisis.
Yeah, I think it's all has to do with also having collective intentions of living more sustainable together. Of course, we can share space and things and have a co-living more of a convenience. But I think the big difference is there when we also start to care for each other and have that as an intention, which is also very meaningful. And as we heard also Mikkel talking about, it's happening. People are organizing to help each other in crisis. And if the architectural layout or the planning of an area can help us to coordinate better or to meet easier and also to have space for that, I think this is a great opportunity.
Thank you so much, Siv, for that perspective as an architect who also planned this co-living kind of space. I believe there was a question, Helle? Otherwise, yell. I can hear you.
Yeah, all right. So the question is, can we consider co-living to be an acceptable alternative housing solution in the context of a pandemic? For instance, the large numbers of residents using communal kitchens, open space, lounges, etc., more mixing.
Oh, yeah.
And then another one. And how do we refine or identify an appropriate density for such schemes whilst achieving sufficient square meters per resident?
Okay, so I am wondering who to pose that question to, because there are more of you that are. Could you guys hear the question? Were you able to hear it? No, not entirely. It's a question. Well, basically, the first question was, how can we have co-living spaces as an alternative way of living during a pandemic, where it is essential that people keep distance from each other, and the person asking the question was referring to communal kitchens, communal areas as such. So the difficulty of social distancing, basically, when you have a co-living space. Do you have any perspectives of that, Siv, as an architect as well?
Yes, as I pointed out, it all depends on having a good organization, and it's not. For example, we close down the kitchen. Of course, people take their own tools and food with. If we meet, we organize it so that the chairs have 2 meters. So there is a lot of organization around it, but it's possible to organize it safely when we are coordinated. So I think it's going hand in hand with arranging it physically so that it's not easy to break the rules, and it has also this invisible architecture, which is very important, which is about how we organize.
And maybe the co-living spaces of 2020 and forward are with individual kitchenettes or something similar, and not as the co-living spaces we knew back in the 60s or 70s.
Exactly.
Yeah. So there is a little bit more space between you guys. Maybe we can relate later to the second question, Helle, but I would like for now to just hang on to what you just told us, Siv, and dwell a little bit on what Siv just told us, and then what we already touched upon with the vulnerable part of our citizenship, because one of the beastie things about COVID-19 is that it's extra hard for people that are elderly if they get this disease. We all know this. So Realdania has documented in one of their reports that 91% of residents in co-housing communities for senior citizens experienced an increased quality of life, and 75% experienced better social relationships. So during the pandemic, elderly have also been an extra vulnerable group of, citizens. So how was it to live in a co-living space as an elderly person? That is my very not elegant bridge to you, Aksel Goth. Good afternoon and welcome here at Blocks.
Thank you. Thank you.
You are a resident at Kamelia Hus, which is a co-housing community for senior citizens. Yeah. So how have you, what has it been like experiencing living at Kamelia Hus during the Corona lockdown? What was the great parts? Obviously, you still live there, so I expect there will be many of these, but also maybe what were the challenges?
Yeah, just as a beginning, I can tell you our house has 49 flats in very different sizes. We live 60 persons there, and everybody must be more than 60 years old. So we are all elderly persons, and we are very, very different persons. Many singles live here, and a few couples. You can count that out. 49 flats and 60 persons. That means many singles. And for many of the singles, it has been a very positive experience to have the opportunity to see and talk to neighbors in the house. It has worked well to see each other, drinking coffee, talking about everyday's life. We have also once or twice a week had common meals in the evening, being aware, of course, of the instructions from the health authorities. In that way, it has been very good for many of us. The alternative for many of the inmates would have been sitting alone in their own house and flat. But we have always also had many challenges. Some have chronic diseases like allergy or weakness in lungs and heart. And of course, they have been very anxious to be infected. And other ones have the opinion that we will have a fairly normal life also during this pandemic. And this has not been without conflicts. And I think it will always be that way when you have so different expectations to life in crisis or after crisis.
And there's this social element of living closely together, even though you're living apart in these apartments. How has that been expressed during this COVID-19 lockdown?
Yeah, the social life has been rather much limited because of the risk of infections. It has not been possible to arrange common meetings for all inmates as we normally do. And for the common dinners in the evening, it has been necessary to limit the number of participants. But as mentioned before, we have tried to have a sort of normal life respecting the public instructions.
And has it led to any concrete ideas or initiatives at Kamelia Hus, this pandemic and this lockdown?
Yeah, it may sound like a banality, but one initiative is always having to clean everything after the use in all the common places. And we have 6 or 7 common places in the house, and they haven't been used as much as normally. Of course, we don't clean anything all the time in our private flat. We have had some meetings where we tried to find a way to live which would satisfy all inmates, but that was not possible. And therefore, we don't have made a manual for how to act in a future crisis. Because, as I mentioned before, somebody are very anxious and keep the distance all the time, and some other, me for instance, I will have a life. I am 74 years old and I cannot give 2 years of the rest of my life to the pandemic.
Is there anything other than what you just mentioned? Because you said it's difficult to make the same rules or the same size-fits-all solutions in this Kamelia Hus. Is there something you've learned to be useful for potential future crisis?
Yeah, I would say we have learned that it will be necessary to be aware of the very, very different expectations to such a situation. And instead of making conflicts about this, we must try to find the golden mean between the different sides. And also having respect for the different ways to handle the situation, to handle our personal life in a future crisis. I must respect my neighbors who are very anxious because of their health, and they must respect the way I want to handle the situation. But I will say primarily it has been very good for most of us to have this community with the other ones. Nobody has needed to be alone.
So thank you so much, Aksel, and I'm a little bit impressed that the fact that you have so many eloquent opinions on this, being the target group of this pandemic as an elderly person. So based on what you just told me, what you just told us and shared with us, I feel like that's a mini version of the entire society. What do I want? How do I respect others' wish to not want the same? And how can we make room for everyone? So what you just told me, I feel like I should have a round with the 4 of you, the rest of you guys. So based on these learnings, what do you, for the rest of the panel, what do you think will be 1 or 2 most important initiatives that we will be working on when it comes to planning the future cities for the city, maybe in 5 years' time or 10 years' time? We can start out with you, Mikkel. I know it's a difficult question, but
Well,
I
yeah,
know you have
actually.
ideas on this.
Yeah, well, as I said before, the pandemic has sharpened the tendencies more than it has invented new ones. And as I said, I think we are going to see that the inequalities that the pandemic has sharpened is and it's a choice, actually. It's not something that comes automatically. It's a choice whether we want to continue the segregation or want to overcome it. And I think that that the pandemic has sharpened those choices and said that if we want to, then for instance in Copenhagen, that some of the larger public housing areas in the northwest side of the city, Tingbjerg, which has been not a hotspot in Copenhagen, but is one of the most infected areas. If we don't want that, if we don't want Vollsmose to be more or less of a hotspot, then we have to make sure that public housing areas isn't isolated social ghettos. We have to make sure that it has mixed population. But not only there, also in all the more affluent, wealthier areas have to have a mixed population as well. So it's a social task. It's a task to overcome poverty, overcome inequality, if we want to deal with a pandemic in the future. Because what we have seen is that the areas who have done best, mostly, is the wealthier, best educated areas. Overall, there are always differences. So if we want to make our cities able to tackle the new pandemic or the next crisis and the next again, then we have to overcome the segregation and inequality. And that's a large task for us in the Public Housing Association, but it's an equal large task for all the other housing areas and the other parts of society as well. And that part lacks at the moment. We feel sometimes it's only us, the public housing areas, who have this task and have this objective. For instance, we have, as you know, balanced rent. What comes in, the only money that we get in is from the residents who pay their rent, and therefore the income and the outcome equal each other. So when the pandemic hit, we of course in 3B and rest of the KAB community, we gave our citizens respite. If they wanted to, the residents, they could have to 3, 4, 5 months respite with their rent if they fell unemployed or during the pandemic, and have to pay back next year. And so we gave the same offer to local businesses, small local businesses who are renting their rooms with us. I'm not sure that the more private parts of the housing areas in Greater Copenhagen or elsewhere in Denmark had the same, should we say, outlook for people who lost their jobs during the pandemic. And I must say, the risk of losing the money is our residents' risk. If we lose a lot of money on that, the rent will go up, because the only way we can pay for the expenses. So my point is, if we want to tackle a pandemic or another similar crisis in the future, we have to overcome inequality, and that is we have to turn up the volume, as I said before, on what we do, but the rest of society has as well.
Yeah, so it sounds a little bit actually like some of the solutions you're talking about and some of the initiatives are the same that you're actually working on now,
Yes.
but we need to amplify them because the problems are not new, they're just bigger.
Yeah.
Yeah. Interesting. And well, if we look in the panel here, Bo, I believe you could be up next. It's been a while since we heard from you. So if you think could you point out 1 or 2 initiatives or ideas or ways of working that will be central for the way Odense should be planned in 5 or 10 years' time?
Yeah, well, to pick up where Mikkel ended, I think that the first recognition is to acknowledge that equality doesn't come by itself. Equality in society, in housing, comes when politicians, when private housing investors decide that it's something to strive for. I've always wondered why, when we speak about social segregation, why do we only speak about the disadvantaged areas? Why are the more affluent areas not segregated? Of course they are, and the solution has to be that we mix the affluent areas and the disadvantaged areas. And maybe to just pick up on the question asked earlier, which I think was, how do you plan for density when you have a pandemic where density might be a problem? I think we have to distinguish here between overpopulation and overcrowding. Overpopulation is being too many people in a city for us to live healthy. Overcrowding is a question of design. It's a question of design in urban spaces and in housing as well. So the wrong kind of density is a big problem during a pandemic. And I think what we have to pick up on after this pandemic, if life turns into normal at some point, is that relatively normal, yes, is that where you, I mean, where you can get away from a lot of people, where you can relax, where you can, the fact that you can get on your bike or walk instead of having to get into public transportation or your car, that you can have access to green areas that are not overcrowded because there is an abundance of them, is important. So it's densification in the future as well, I think, but it's densification with green qualities, with social coherence, as I said, not as an afterthought, but made into the projects.
So taking these in consideration already as we plan for the next cities. And that's a little bit, actually, it brings me a little bit to you, Camilla, because we talked about, you touched upon this planning situation where developers, maybe due to normal capitalistic needs, are thinking, I should put as many apartments into this building as I possibly can. And the easiest way to do that is with one source of light. And it is by putting the apartments together this way. It's been very effectively done. If you could see some kind of change, one or two things that you would love to see within the next 5 to 10 years when it comes to the more flexible housing, flexible homes, what do you think is key?
In a very general way, I would point out that today it's very trendy to talk about transformation in architecture. But I think the goal must be to plan and build in a way today that allows us to recreate without needing to totally transform in the future. Our life changes, society changes. So I think the demand on us architects and developers and everybody is to design in a resilient, long-lasting way, inside and out.
Yes. So we need to design in a resilient way. We need to make sure that whenever we get the idea of a new area, we're all ready to begin with. Think, how can we make this a super local area where people can bike or walk to the initiatives that they will need for their normal lives? And some of the problems with the social housing are the same, but they've been amplified during this crisis. So that brings us to you, Siv. In Stavanger and in the co-living space that you created there, perhaps. What kind of initiatives would you point out? Because I guess that living at Windmøllebakken maybe have opened your eyes to some of the new ways of, not new, but revitalized ways of living that not all people know today.
Yeah, definitely. And we are working to develop further the model of gaining by sharing, a co-living model, which we are also at the moment trying out in different projects around in Norway. But I believe that our societies are going to face really challenges of scale with loneliness, an elder generation, segregation, newcomers that we have to be able to integrate in good ways. So how can we plan and organize our housing in a way which help all these issues? This must be a collaboration between private and public stakeholders. It cannot be solved by private investors. So I really want to engage in trying to make this understood, because I think there is so much to gain by putting all of the stakeholders that are participating in developing housing together. I think there is the synergies that we need to solve our huge problems to come.
Thank you so much, Siv, and thank you each and every one of you, because that's actually all for today. I want to thank everyone in the panel. I want to thank the sparse audience that are here, and I hope everyone else had a good time watching from back home. If you want to hear more about cities, you can follow the BLOXHUB website, because there are several new events coming up just like this one. Thank you very much for today, and thank you.